Hi, in this video I will share what psychedelics and types are. Also highlight some of the controversies around the drugs. I hope you will find value in this video. What are psychedelics and types? Psychedelics are a class of psychoactive substances that alter an individual's perception, cognition, and mood. These substances produce a range of effects that can include changes in sensory perception, thought patterns, and emotions. There are various types of psychedelics, some of which include LSD, lysergic acid diethylamide, a synthetic compound that produces strong visual and sensory hallucinations. Psilocybin, a naturally occurring compound found in certain types of mushrooms. It produces changes in perception and mood. DMT, dimethyltryptamine, a naturally occurring compound found in certain plants and animals. It produces intense visual and auditory hallucinations. Mescaline, a naturally occurring compound found in the peyote cactus. It produces a range of sensory and emotional effects. Ayahuasca, a plant-based psychedelic brew used in traditional Amazonian medicine. It contains DMT and produces intense visual and emotional experiences. Ketamine, a dissociative anesthetic that can produce psychedelic effects at high doses. It is currently being investigated as a potential treatment for depression. MDMA, 3,4-methylene dioxymethamphetamine, a synthetic compound that produces both empathogenic and psychedelic effects. It is commonly known as ecstasy, and is often used recreationally. What are the controversies around psychedelics? Psychedelics are a controversial subject due to their potential risks and benefits. Some of the controversies surrounding psychedelics include legal status. Many psychedelics are illegal in most countries, and possession or use can result in criminal charges. The legality of these substances is a subject of debate, with some arguing that they should be decriminalized or legalized for medical or therapeutic purposes. Risks. Psychedelics can produce unpredictable and potentially dangerous effects, particularly in individuals with underlying mental health conditions. The risks of long-term psychological effects or physical harm from repeated use are also a concern. Lack of regulation. The quality and purity of psychedelic substances can vary widely, and there is little regulation of the production and distribution of these drugs. This can result in individuals unknowingly consuming substances that are contaminated or of low quality, leading to potentially harmful effects. Stigma. Psychedelics are often associated with counterculture and drug use, leading to stigma and misunderstandings about the potential benefits in medical and therapeutic settings. Cultural appropriation. The use of traditional plant-based psychedelics, such as ayahuasca, by non-indigenous individuals has been criticized as cultural appropriation and disrespect for indigenous cultures and traditions. Can psychedelics drugs be used to treat mental health conditions? The use of psychedelics for mental health treatment is a controversial and rapidly evolving area of research. While there is growing evidence to suggest that psychedelics may have therapeutic benefits for certain mental health conditions, there are also significant risks and limitations that must be considered. One of the most promising areas of research for the therapeutic use of psychedelics is in the treatment of depression and anxiety disorders. Studies have shown that psychedelics such as psilocybin and MDMA may have significant short-term benefits for individuals with treatment-resistant depression and post-traumatic stress disorder, PTSD. Additionally, some studies suggest that psychedelics may have potential for use in treating addiction, cluster headaches, and other conditions. However, there are also significant risks associated with the use of psychedelics. These substances can produce unpredictable and potentially dangerous effects, particularly in individuals with underlying mental health conditions. There is also a risk of developing long-term psychological effects or physical harm from repeated use. Additionally, the quality and purity of psychedelic substances can vary widely, and there is little regulation of the production and distribution of these drugs. Another concern is the cultural appropriation and disrespect for indigenous cultures and traditions that can occur with the use of traditional plant-based psychedelics, such as ayahuasca. Overall, while there is growing evidence to suggest that psychedelics may have therapeutic benefits for certain mental health conditions, the risks and limitations associated with their use must be carefully considered. Psychedelic-assisted therapy should only be administered by trained professionals in a controlled clinical setting with appropriate safety measures in place. Future challenges of psychedelic drugs. As the use of psychedelic drugs for mental health treatment becomes more widespread, there are several challenges that will need to be addressed. Regulation and legalization. The legal status of psychedelics is a major barrier to their use in clinical settings. As research into their therapeutic benefits continues, there will be a need to develop regulatory frameworks that allow for their safe and responsible use. Standardization and quality control. The quality and purity of psychedelic substances can vary widely, which can pose a risk to users. The development of standardized production methods and quality control measures will be essential to ensure the safety and efficacy of psychedelic drugs. Access and affordability. Psychedelic-assisted therapy is currently only available to a limited number of individuals due to the cost and availability of treatment. As the demand for these therapies grows, there will be a need to develop more affordable and accessible options for patients. Cultural sensitivity and respect. The use of traditional plant-based psychedelics, such as ayahuasca, raises concerns about cultural sensitivity and respect for indigenous cultures and traditions. As these substances become more widely used, it will be important to address these issues and ensure that their use is conducted in a culturally sensitive and respectful manner. Education and training. Psychedelic-assisted therapy requires specialized training and education for healthcare professionals. As these therapies become more widely used, there will be a need to develop training programs and educational resources to ensure that healthcare professionals are equipped with the necessary knowledge and skills to provide safe and effective care. In conclusion, the use of psychedelic drugs for mental health treatment is a rapidly evolving area of research that holds significant promise for addressing treatment-resistant mental health conditions. However, there are also significant risks and challenges that must be carefully considered and addressed, such as regulation, quality control, access, cultural sensitivity, and education and training. As research in this area continues to develop, it will be important to strike a balance between maximizing the potential therapeutic benefits of psychedelic drugs and minimizing their risks and limitations. Thanks for watching, share, subscribe and like this video.